My name is Randy Friesen from Prince Albert, and I'm going to tell you how I spent your and my CQIP time and money. You'll recognize this cartoon if you've taken the course. So I like to think obliquely, and my first question was, is this really true? Why did I think that? I love the KISS philosophy. But as soon as I looked at the cartoon, I realized that's way too simple to be true. But I digress. How did I get involved in CQIP? It was a series of circumstances, a critical incident where a patient died after having a CT scan. I read an article on the risks of radiation exposure during CT scans. My colleague, Dr. Hammond, who's one of the coaches here, did a CQIP project, or a QI project, about CT scan appropriateness. And last but not least, as I looked at the wall walk for our then health region, I noticed that our waiting times for CT scans were always a red dot. I thought that's a perfect opportunity. So I'm going to frame my talk about what I'm actually thankful for. I'm thankful for the learning I got, for the relationships, for the support, and for the spirit in which this was done. Well, I'm a bit of a curious George. I love to learn. And at my age and stage, that might look impossible, but it's not. I was completely engaged, talking about change theory, variation, appropriateness, learning about Excel, how to make a graph. Those were all new things to me. It was very exciting. I also enjoyed the variety of techniques that were used to impart this knowledge. We had online learning modules. We had one-to-one sessions. We had large groups, small groups, self-reflection. It was fantastic. When my son was 14 months old, barely walking, he saw a swimming pool for the first time and decided to walk into the deep end. So as I ran over to potentially rescue him, he came up. And the look on his face was somewhere between abject terror and complete fascination. That was us, right? Workshop 2 and 3. Well, fascinated but terrified. My real concern was, how in the world am I going to get this done? I'm going to need a ton of people to do this. Bang on. Thank God for Teams. I was shocked to see how eager people were to help. All they had to do was learn about the purpose of the project. We want to get patients in for their scans on time. Department leads from ER and diagnostic imaging, managers, data people, clerks, everybody seemed to want to help. I was shocked. I was also completely engaged with my peers at the workshops. They would listen to my stories. They had to. But I also learned a ton from listening to their stories. And I'm very grateful to my coaches. We didn't spend a lot of time together, but the advice I got was bang on. So thank you. I was shocked to learn that we were going to do self-reflection at these sessions. I thought, was this kumbaya? Was this some kind of new age monastery experience? No. I found that actually self-reflection, as it is in our personal lives, can help us discover what our real purpose is and can actually light the fires of motivation and keep us going through the tough times. So thank you even for those moments. Now I'm going to get the audience to participate because it's been way too quiet. Say autonomy, mastery, and purpose. Autonomy, mastery. Oh, you guys are totally awesome. I've repeated this to myself over and over and over again as I've struggled with people who don't seem to be engaged. It works. Autonomy, mastery, and purpose. Thank you for the support. My local peers, our local quality people, thank you guys. We were supported right through this, right from the start. I'm grateful to the SMA for pushing us, making us feel safe. Thank you to HQC, who quietly, behind the scenes for the most part, have just kept this thing going. We really, really appreciate it. And of course, somebody's got to pay the bill. So thank you to the ministry and SHA, that blurry line. Thank you for continuing to support us. And thank you, Scott, even though you aren't here, for promising further support. Yay! Last but not least, I'm very grateful that I encountered a culture of curiosity, an atmosphere of safety, and an abiding focus on why we're here, which is our patients. I'm going to have one last slide. If you want to see my data, come and check out the poster. We've got 3 points in a row below the line, so if we get a fourth one, we have a twin. Thank you very much.